Hello friends, as promised, we are continuing with type 1 diabetes education in a simple and entertaining way, and today we are going to discuss a very important topic. Diabetic ketoacidosis, or DKA, is the most dangerous complication in type 1 where the excess of ketones and acid in the body, along with a lack of water and electrolytes, can pose a life-threatening risk. It is the leading cause of premature death in people living with type 1. But with appropriate monitoring at the right time and taking proper measures when it occurs, its danger can certainly be avoided. As you know, like everyone else, children living with type 1 can also be affected by all kinds of illnesses or conditions, which include everything from the common cold and vomiting, diarrhea, to infections like TB or typhoid, and from road accidents to the need for surgery. For any such unhealthy condition, people living with type 1 should take specific steps known as sick day rules. While fever due to illness typically sees elevated blood sugar, with vomiting and diarrhea, there is a possibility of hypoglycemia. While precise guidelines for its monitoring and initial treatment are available from various professional societies, but it is unfortunate that most of the complications in this condition are seen due to neglect and misunderstanding of this condition among the people living with type 1. Now, with this background, you must have understood how important it is for all of you to clearly understand and follow these sick day rules at the right time. In today's Who Will Become a Type 1 Genius quiz game episode, 20 questions related to sick day rules will be asked. I urge all of you to try to answer each question yourself while playing, and let us know in the comments how many out of 20 you got right. Let's see who will become a Type 1 Genius today.
Ladies and gentlemen, welcome to this amazing game. All today's questions will be based on sick day rules. Let's play Who Will Become a Type 1 Genius. Our first contestant today is 17-year-old Aradia. So Aradia, are you ready for the first question? The first question is, what should our blood sugar target range be on a sick day? The options are 100 to 180, 150 to 250, 70 to 200, or 70 to 180.
Answer is 70 to 180. And along with this, the level of ketones in the blood should also remain less than 0.6 millimoles per liter.
Correct answer. The next question is actually related to blood ketones. You have to tell which ketones are primarily measured by blood ketone meters. The options are beta-hydroxybutyrate, acetone, acetoacetate, or all three are measured.
Sir, the answer is beta-hydroxybutyrate, which is considered the most important ketone in the blood. Its monitoring is considered better than urine ketone monitoring. The other two are also types of ketones, but they can only be measured with ketone sticks in urine.
Your answer is absolutely correct. In the next question, you have to identify which option among these four is not true about a sick day. First, in most children with a fever, sugar levels appear to increase. Second, there is a risk of hypoglycemia with vomiting and diarrhea. Third, blood sugar normalizes as the illness improves. And fourth, on sick days, insulin dosage may need to be adjusted, but insulin should never be stopped.
Sir, your third option is incorrect. The effect of any illness on blood sugars can be observed for several days or weeks even after the illness has healed. All your other options are absolutely correct.
Madam, let me tell you, these options are not mine. They are from the computer. But your answer is absolutely correct. In the fourth question, you have to tell us how often we should check blood sugar during a sick day. Every 1 to 2 hours, every 3 to 6 hours, 2 to 3 times a day, or check whenever something seems off.
During sick days, it is very important that we check our blood sugar every 1 to 2 hours and also check blood ketones every 2 to 4 hours. Negligence in this usually leads to DKA.
You said it perfectly and explained it very well. Thank you. In the next question, can you tell us which of these could be the reason for feeling nauseous and wanting to vomit during a sick day? The options are high levels of sugar and ketones in the blood due to hypoglycemia, symptom of the illness itself, or any of these could be a reason.
Thus, in a sick day, feeling nauseous or feeling like vomiting can be due to any of these reasons. It can only be determined by proper monitoring.
Yes, your answer is correct. Aradia, as you may know, it is very important to keep taking liquids frequently to maintain hydration during dehydration. You have to tell how much liquid is recommended for a 20-kilogram child to take every hour. The options are 100 milliliters, 200 milliliters, 300 milliliters, or 400 milliliters.
So during a sick day, 4 to 6 milliliters of liquids per kilogram of body weight should be taken every hour. So the answer is approximately 100 milliliters per hour. And also, it should be sipped gradually over time. Drinking it all at once may cause nausea.
Correct answer. The next question is related to same topic. Above how much blood sugar level in milligrams percent we should take only carb-free liquids? The options are 150, 200, 225, or 250.
Sir, when the blood sugar is found to be above 250 during sick day, we should stop the intake of sugar or carbs in liquids. In such cases, only salty liquids like buttermilk or salty lemon water are suitable.
Your answer is correct. In the 8th question, tell us above how many millimoles per liter of blood ketone level is it recommended for a child to be treated in the hospital for the risk of DKA? The options are 1, 2, 3, or 4.
Sir, the answer is 3 millimoles per liter. Beyond this, there is a possibility of DKA. But apart from this, if there is continuous vomiting, diarrhea, high fever, unconsciousness, fluctuations in blood sugar, or if the child is very young, treatment in a hospital is advisable.
Correct. And we all need to avoid DKA. So, in the next question, tell us whether the presence of ketones in the blood always indicates worsening diabetes or if it could be due to any of these reasons. The options are due to fasting, drinking too much water, sleeping too much, or taking fever medication.
Ketones may appear in the blood due to hunger, which is known as starvation ketosis. However, their levels usually do not increase significantly.
Aradia, you have reached the final stage of your game. For the 10th question, you need to tell us due to which type of problem an insulin pump may not work properly, which should be checked. The options are tubing twists or air bubbles, leakage in the connection, skin issues under the catheter, or could it be all these reasons?
Sir, this question turned out to be the easiest for everyone. The answer is that all options are correct.
Aradia, this question is not so easy. In fact, your preparation is very impressive. Congratulations on winning the Type 1 Genius title.
Friends, did you see how our Type 1 genius, Aradia, answered all the questions in such detail that I didn't need to step in and explain? So, let's see how our next contestant, Jasine, is prepared.
Jasine, welcome to our game show. For the first question, tell us if someone's blood sugar is consistently around 300 milligrams percent during a sick day, what change should they make to the insulin bolus dose given before meals? The options are double it, increase by 10 to 20%, keep it the same, or stop it.
Sir, increase it by 10 to 20% and if needed, give a correction dose after 2 hours. Why are you talking about stopping it?
Your answer is correct. Oh, excuse me, we won't stop it at all. In the next question, tell us when in such a situation, the basal dose of insulin is increased in comparison to the bolus dose? The options are both together, basal dose before the bolus dose, basal dose after the bolus dose, or the basal dose is kept the
Sir,
same.
when blood sugar appears high in the sample, the bolus dose given with food is increased first. If after doing this, blood sugar remains in the higher range continuously for 3 days or seems likely to remain, then only the basal dose is also increased by 20 to 30%.
You have given the correct answer. Now you have to tell which of these indicators appropriately assesses the hydration status in a sick day. The options are How much water was consumed? How much urine was passed? How much food was eaten? Or how much change occurred in body weight over the last 4 to 6 hours?
The answer should be a change in body weight because other measures can be affected by illness and the condition of diabetes. That's why it's good to have a weighing machine in such cases.
This answer is also absolutely correct. The next question is related to the stomach illness gastroenteritis. In this condition, if the risk of hypo develops, what change should be made to the insulin dose? The options are: reduce the basal dose by 20%, reduce the bolus dose by 50%, make no change or stop insulin.
Why are you stopping the insulin again?
Oh, madam, forgive me. It's not us. It's the computer that keeps stopping repeatedly.
The first two options are correct. But remember that if ketones are positive, it's not proper to reduce the amount of insulin. Even if there's a fear of hypoglycemia, an appropriate amount of insulin is given with carbs in such cases.
Very good. This was a trick question, and you gave a very nice answer. And sometimes in gastroenteritis, a mini dose of glucagon is given for hypoglycemia. You need to specify the dosage for a 10-year-old child. The options are 2 milligrams, 1 milligram, 0.1 milligram, or 0.2 milligrams.
From 2 to 15 years of age, it is 0.01 milligrams per year. So the dose is 0.1 milligram.
Wow, madam, we are quite impressed with your understanding. Now, in the sixth question, please tell about a 7-year-old child weighing 20 kilograms who is currently in the honeymoon phase and whose total daily insulin dose is only 5 units. During a sick day, how much extra insulin should be given as a bolus? Options are 0.1 to 0.2 units, 1 to 2 units, 2 to 4 units, or 5 units.
Sir, during the honeymoon phase, the insulin dose is quite low. But during sick days, it is appropriate to give insulin based on body weight instead of the daily dose. About 0.1 unit per kilogram, 1 to 2 units would be fine.
You gave the correct answers with the right explanation. In the related next question, tell which of the following methods can be used to adjust the extra insulin dose on a sick day. Options are body weight method, percent increase method, total daily dose method, or guesswork method.
What is this guesswork method? Never heard of it. Actually, all the other methods are fine, which are used in different situations. As we just discussed, the body weight method can be used during the honeymoon phase. In the percent increase after calculating the correction dose with ICR and ISF, it is increased by 10 to 20%, and in the third method, 10 to 20% of the total daily dose is given as an additional insulin dose.
Your answer is correct, and you also correctly said that guesswork is not okay. In the next question, tell us which option is correct regarding the use of an insulin pump on a sick day. The options are: the correction dose should be included in the basal rate. Running a hybrid loop system in manual mode is fine. The pump cannot be used in the hospital, or long-acting insulin should be used in the pump.
Sir, it is appropriate to run the second option, meaning the hybrid loop system, in manual mode because during sick days, due to ketones, there may be frequent changes needed in the dosage.
Correct answer. In the ninth question, tell us if the amount of ketones in the blood is between 1.5 to 3 millimoles per liter. Which of these calculations is appropriate for the insulin bolus dose? The options are an additional 20% in the correction dose, 0.15 units per kilogram of body weight, 20% of the total daily dose, or any of these methods can be used.
Sir, all these methods are correct. Any method can be used according to the situation.
Wow, amazing. You have also reached the final stage of your game. Let's see if we are going to have 2 type 1 geniuses today. Your 10th question is about using a CGM device in diabetes. You need to tell which of these options is not correct. The options are: in such cases, checking capillary blood sugar with a regular glucometer is also okay. Some common medications can interfere with the action of a continuous glucose monitor. Dehydration in the body hinder the function of these devices, or does it not provide any special benefit?
Sir, all the other options seem fine But something seems wrong with this last option. Using the CGM device in the regime can provide better monitoring of the continuous fluctuations in blood sugar, which is a special benefit.
Madam, you have also become our second Type 1 Genius of the Day. Many congratulations to you.
Did you see how Aradia and Jasine answered all the questions correctly to win? Friends, knowledge and compliance with sick day rules are very important. Detailed guidelines are provided for sick day monitoring and management by ISPAD and ISPAE. Make sure to understand them in detail from your diabetes specialist and educators. Hope that you liked today's presentation, and by following the information given, you will not let DKA happen again. I hope that you won't forget to forward this film to its beneficiaries and to send your suggestions in the form of comments and subscribe to the channel. We will meet soon with our next interesting piece. Till then, please take good care of yourself. Bye for now.